Hi, Erin.
Hi, how are you?
Good.
My name is Erin, and I am very pleased to welcome you all here. This is the first Pennsylvania MGMA Power Lunch. I hope that you all, I don't see anybody eating their lunches yet, but feel free to eat your lunch and while we sit and chat for a bit. I am very pleased to welcome our host today. Paul Brewer is a member of the Pennsylvania MGMA board. He is also the practice administrator for dermatology LTD. He's also a certified practice administrator, CMPE, and Paul has volunteered to be our first host of this series. The purpose of this series is for some of our practice administrators and our affiliate members to chat about some of the pressing issues that we're all facing in our practices today. And the first issue that we're going to talk about right now is about the COVID-19 vaccine and the issues that we're all looking at. So Paul, do you want to take it away?
Absolutely. Thanks, Erin. Well, welcome everybody, and thanks for joining. I had a chance to check with Erin ahead of this to find out a little bit about where people are going to be connecting from. And it's great to know that we have representation from throughout the state, that there are people on right now from Eastern Pennsylvania, Central Pennsylvania, Western Pennsylvania, and hopefully everywhere in between. So welcome. And yeah, this is the first time we're doing this. And as Erin mentioned, I volunteered to really just help facilitate it. And today our focus is to talk about where things are with everybody related to receiving the COVID-19 vaccine. And just wanted to share with everybody that we all deal with challenges every day. And I dealt with my own technology challenge about 20 minutes before this started, and that my laptop went into doing a Windows update that all of a sudden froze my keyboard. So I was contacting Erin and I said, you know what? I think I'm going to have to just connect through my phone today because my laptop is not working at the moment. So, it's just an example of what we all have to deal with every day, but hopefully this will be fine. And I also thought it would be fun to do a couple of questions that Erin will put up. And it's one of those options where you can just answer and then we get the poll results and everybody sees it right away. I think that this will be fun and just a way to kind of gauge where we're each at. So to get us started, Erin, would you put up the first poll question? And this is just to find out if you've already received the vaccine personally. And, the options are that you've not received it all, or first dose only, or first and second dose. So everybody can just take a moment to submit, and then Erin will bring up the responses. And of course, this is very informal in that you can feel free to eat lunch while we're all on. Mm. Okay, so it's interesting. 50% have already received the first dose. So this is a good indicator for where we can start talking. And again, I want everybody to feel like they can share whatever they've experienced with this in your individual areas, because we're hoping from these lunches to really learn from each other. And so, it looks like half have already at least received one dose. And maybe to get things started, if you're connected with a large health system and you want to just share some of what you experienced in your practice through being part of a large health system and what that was like in terms of getting the vaccine out to everybody connected with the health system.
So Paul, this is Mary Ann. I'm not connected to a health system per se.
Right.
I'm in private practice. But I can say from the flip side of that, we're across the gamut here on Eastern Pennsylvania, and some of our health systems like Mainline Health, where very proactive about engaging our urology practice. They engaged us immediately, got the doctors vaccinated right away, even though we're private, we're on staff there. And then they extended it to our frontline staff in our offices. Other systems we have yet to hear from. And so I guess it really depends. So I guess internally, if that person isn't on the phone, some of them did it because of the people that were refusing it.
Okay.
So I guess they wanted it used. They wanted to use the vaccine, and I'm thrilled that they did. So they offered it. And now, as we all know, that's not the case anymore. Now there's a shortage.
Right. Yeah, so you and I are both on the eastern side of Pennsylvania, and we have in Delaware County, there are a couple of large healthcare systems, the Crozier Keystone system and then Mainline Health. And I know that they have started reaching out to individual practices, and they each have their own methods for how you need to enroll to be put on that list. But what I do know is that it takes a proactive approach on the part of the private practices to reach out to them. For example, in our area, if you are in private practice and your physicians and your providers are, say, connected to Mainline Health, you need to contact Mainline Health and let them know, hey, we're a private practice and we're interested, and that's important to get it initiated. And it seems that has started to work, especially now as we're getting near the end of January, where I think that they are finding that they've gotten through a lot of the first line healthcare providers. And it's really now more a question of, do they have enough vaccine to start in on the other groups? How about others? Maybe someone from a different part of Pennsylvania that's had success with getting the vaccine that can share their story? Okay, so maybe we can focus on challenges that people are having with getting the vaccine. If there's anybody that wants to share any of their frustrations that they've had where they've not been able to get it.
So Paul, this is Mary Ann again.
Yeah.
Actually, to follow up, we've had the most success here in we're in all the 5 counties surrounding Philadelphia, but we've actually had the most success dealing with the departments of health.
Okay.
But as you know, like Delaware County doesn't have a Department of Health, so your only choice is to go to your healthcare system to get it. But Montgomery County, which is where my office is located, actually did most of the vaccinations for the people in my practice. Okay. We reached out to each of the counties, and they've been the most responsive. We were, up until very recently, as new people came on board that were interested, and I know that's the next conversation you want to have to segue into, is not everybody, when first offered, wanted to take it. There was a lot of fear. And so we got that first wave done. And now I guess as time is marching along, we have the opposite problem. Now people are saying, well, maybe I should get it. And now there's a shortage of vaccines. But I think another great resource to get it is if you have a Department of Health, they've been very, very helpful for us here.
Thanks, Mary Ann. That's a great point. And that is true in our area. As Mary Ann mentioned, in Delaware County, there is not a Department of Health. So Delaware County is partnering with Chester County, which does have a Department of Health. And they are another source locally that has been very, I would say very open to trying to work with as many different groups as possible. And they have a site set up in Chester County. And I learned recently that there is now a second site in Delaware County, I think perhaps in Aston area. So that's another option for people in our area to go through the Department of Health. How about others? Are there other people on this that have gone through the Department of Health in your community? Hi.
Hi. I'm in Philadelphia, so we very much have had lots of contact with our Department of Health, and we're a primary care practice, so we had the relationship already for the vaccine program. So that outreach came from them. We filled out all that information and then have been able to get our vaccines that way. And then there are weekly webinars, workshops that the city is holding with providers to give them updates about quantity, when you can order, when the guidelines were changing. So we've been able to stay sort of ahead of that. Like this week's call let us know that we would now be able to order a set quantity each week. Whereas when we started in the beginning of January, it was, well, tell us how many you need and we'll tell you maybe how many you're going to get. And so we started immunizing our staff, and we included our medical assistants and folks who do outreach into the community for testing in the first round, held back on the people who are completely remote in their care. And now that we're approaching next week of doing that second dose, and we've been able to start with patients, we're actually offering it to the people who are remote as sort of the fill-in. You know, somebody else canceled, now we have a dose available in that vial. We have a list and it's, you know, can you come in the next, 2 hours to get this shot? So that's how we're managing loss, potential loss.
Wow. Well, that's great. So what is the group that you're with? I'm sorry.
I'm at Mazzoni Center.
Mazzoni Center.
In Philadelphia.
Okay. All right.
Yeah. So I'm not actually the practice manager. The practice manager gave me her login so I could hear what you're doing.
Could I ask Nancy a question? Did I understand that you're, as a primary care physician, starting to administer vaccines to your patients?
Yes.
And is that new, or have you been doing that for a while?
We started last Friday, so we're less than a week.
Okay.
Wow.
It's interesting because I got in my email just this morning. I'm in the Abington Jefferson Health System. And so my primary care physician office is letting me know that they will be getting vaccines, which I didn't really think they were going to be doing that. I think it's the same grouping though, right, Nancy? Like you got to be over 65 or have those comorbidities, right? But now, instead of going to, like here in Montgomery County, they were going to Montgomery County Community College. Those same people may have the option of going to their private physicians now. Oh, that's good to know.
I saw the Jefferson email as well, and I was like, oh, you've gotten to patients. I would suppose that for them, they have so many more employees that they needed to get to that it took longer for them to reach the patient point than with us, where our whole employee panel is only 112 people. So when we got 100 doses the first time, we were almost done. And wanted to move on, and they said no. The city said no, you have to wait. And then we moved to healthcare providers who were also patients, and so we sort of shifted into patients, but we had to be able to identify them as healthcare providers. And then we moved into patients. And in Philadelphia, you have to be over 75. The criteria is different than from the rest of the state, which is over 65.
Oh, I didn't know that.
Yeah. So
do we have anybody else from I saw a 412. That's mid state, isn't it, Paul?
I think so. Yeah.
Yeah. I wonder.
That's so interesting.
I'd be interested to know what's going on outside of our little corner of the Pennsylvania here.
And that's interesting that the city of Philadelphia has its own requirements that in this case, it sounds like they supersede what the states are, right? So they're requiring that you have to be over age 75. That's very interesting.
They're still doing the chronic diseases. But
Okay.
not just, it's chronic diseases, specific ones, and then over 75.
Okay.
Wow.
Which is causing a decent bit of confusion, of course, because everyone hears that it's over 65 and they're like, oh.
Right.
And it's like, well, if you have a chronic medical condition, you're still in there. So
Hmm.
age doesn't matter if you have the medical conditions. If you're a healthy 67-year-old, it does matter, but they'll be in the next wave.
And do
Wow.
they need to live in the city limits, or do they need to work, or is it and both?
It hasn't specifically been stated. I think I saw information from Penn that said that they were administering to people who were residents of a particular county. But I think I would assume the city would prefer that we keep it to people who live in the county, but I haven't seen anything that's a requirement.
That's interesting. Thanks for sharing that.
Mm-hmm.
Well, that's very interesting, Nancy. Thank you for sharing that. And it actually, it kind of leads into our second poll question today, which has to do with whether you as a practice are planning to administer the vaccine to patients. So maybe, Erin, if you want to go ahead and put that second question up. And again, it'll just take a minute for her to tabulate the results, because I know that the Pennsylvania MGMA is certainly made up of a lot of practices from large health systems and small health systems, and not everyone is a specialty. There's a lot of primary care. So that's why I thought it would be interesting to find out of those practices that would be primary care focused and able to administer the vaccine to their own patients, to get a sense of how many are planning to do that. And that's obviously, Nancy, you're already doing that.
That's interesting.
That'll probably be coming back up here in just a moment. As this comes back up, if there are others on the call that are planning to, okay, so half are planning to administer the vaccine. That's a lot of participants, and so I think there's about 20 on the call today. So there's probably 10 anyway that are. Let's see. Does anyone that's on the call want to share their experience with either that they're also already administering to patients, or that they've applied and what that process has been like?
Paul, the other question I'd like to have answered is, of the people that said no, like you're dermatology and I'm urology, I wouldn't do that, but I'd be interested to know, of the primary cares
Right.
on the phone, how many are saying no, and why they chose to not do that. I'd be interested to understand that.
Yeah, that's a great question, Mary. And if you are on the call in your primary care, and if you've chosen either to do it or not to do it, and want to share your thoughts on that with the group, that would be wonderful. Well, Nancy, you've been a great resource for us in talking about what's already in place for you in Philadelphia. So that may be something that others could feel like, if they needed to reach out to you, that might be possible, to just understand what you've put in place there.
Absolutely.
So thank you for sharing that.
Absolutely.
Yeah.
We use Athena as our EMR, and they've also put together a best practice guide to help practices. So I don't know if your EMRs might not also have put something together. It just came out on the 21st. So that might be another resource for folks as well.
Thank you. And, another issue that I've been thinking about that would be interesting to talk to everybody on the call about is whether or not you're receiving the vaccine mandatory within your practice, or if you are just allowing it to be on a voluntary basis. And I know that there's a lot of information that's been published in terms of what the law states on this. So I would just be interested in talking about that and getting a sense what practices are doing in terms of the requirement or not to receive the vaccine, or just how that's been within your practice in terms of if there are people that are reluctant, and if so, maybe what some of their reasons have been, and just to share your experiences with that. I can let the group know that in our practice, for the most part, most of our employees are interested. Those that are not have more or less said they wanted to wait. They didn't say no. They said they wanted to wait a while. And I think that's a comfort level for them. And for us right now, that's okay. We are not making it mandatory, but we are strongly encouraging it and trying to answer any questions that people might have as far as understanding how this FDA emergency use process works and what that looks like compared to the normal protocols.
We're here in our offices are down in Maryland, Paul, and we're hearing almost a 50% refusal rate even among healthcare people, healthcare workers, and so it is, Maryland's vaccination rates are not good.
That's
And
interesting.
at the state. So, but even in this first round, we're hearing as much as a 50% refusal rate. So it's disheartening, and something that we're hearing that it is more of an education issue. And even among healthcare workers, that they don't understand the vaccine, that they don't understand the process. They don't understand how it was developed so quickly. They don't understand these things. So they're really looking for some guidance and some better education programs to try to make people understand why it would be safe and effective to take this vaccine at this time.
Erin, this is Marianne. I recently received some really great YouTube videos from a colleague that is at the Pennsylvania Medical Society. And why I love them, they were done like Dr. Fauci and those, but they were done specifically for nurses and specifically for doctors. And our experience here, similar to Paul, the physicians did it right away. It's the nurses and the MAs. It seems people in their reproductive years are nervous that it may lead to I think they said there were 3 in the original studies for these drugs. There were only 3 pregnant women. And it was my understanding at the time that they had not even given birth yet. So those were the kinds of things that we were hearing here. And so I received those just a week or so ago and carved out some time to listen to them. And I think they really speak to medical people. So Pennsylvania Medical Society has them on their website.
Yeah, I'll have to look for them.
Yeah, they were a great resource for me. So I'm happy to pass along good resources.
Thank you.
Thank you, Marianne. That's great. I was not aware of those, so I'm going to check those out myself.
I thought Peter was distributing them. I thought he did, but maybe not.
Oh, okay.
Yeah, they really were. And I love that. Again, they know what they're doing. They're talking to individual clinicians and meeting them where they are. I'll find it and forward it to you, Paul.
Thank you.
I could say that I was pretty hesitant to get it. Some very similar questions and concerns, and it was really helpful. I attended a national webinar that Dr. Fauci was part of, and some other leaders. And it was really helpful to hear about how long the technology has actually been, around. I was like, so now I say to patients, it's new to us, but it's not new. It's been
Right.
around for quite some time. And it's
Well
just that we
said.
didn't know about it, and it was working on this family of viruses. Like, to be able to get those things to say to patients has really been helpful and helped with my own hesitation as well. But I also felt like I can't, just in general, my practice is I can't say to someone else, this is what you
Right.
should do, if I'm not willing to do it myself.
Right.
And so
Right.
everybody's like, well, did you get it? And I'm like, yes,
Yeah.
yes, I did. And I'm
Yeah.
still here. I haven't sprouted a third arm. Like, it's okay.
Yeah, and then going through it and just feeling like by getting educated yourself, you felt more comfortable, and then you're able to pass that, not just that assurance from your personal experience, but also the information that you learned you can share with them. So that's wonderful.
Though I will say that most of our physicians now have had their second shot, and they are all exhibiting those flu-like symptoms that you're reading about, and they kind of all lose a day, and then they really do get up the next, a lot of my physicians got it on Saturday. This past Saturday, I had probably, more than half of my practice went back to Mainline Health for their second shot, and they all reported feeling very sluggish the rest of the day Saturday. Sunday was really a wash. Couldn't even muster up to go out and hit a bucket of balls, which is their litmus of how they're feeling. But they were all back to work Monday feeling pretty good. And now that they've communicated that, a lot of the folks that were fearful see that they're all standing. My doctors are more in the older range than younger range. And it really did a lot. I mean, having somebody that they knew having that second shot has made a world of difference, more so than they saw the videos and that sort of thing. And then one very smart radiation technologist reached out to her OBGYN and said, I am afraid to get this shot because I'm planning on getting pregnant. And he said, then absolutely get the shot. So to your point, Erin, about education, you do want to empower people to say, then come find out. Call your doctor. And she was shocked to hear that her doctor said yes.
That's interesting. Yeah. And that is, I to some degree, I think I was aware that women that are in childbearing ages may be concerned about it, but I didn't realize how prevalent it possibly is. But just from this call, I'm learning that maybe is a demographic. And in our practice, there's at least one, maybe two that are in that situation.
When we looked at the group, and maybe Erin can speak to her 50%, that was the age group. Nobody that was older, say that maybe had one comorbidity, they couldn't get in line fast enough. But it was really like that MA 25 to 40-year-olds. That's what we found in our demographic, Erin. I'd be curious to see what you found.
I am speaking from another client that we work with that is in the home care industry.
Okay.
And they do, and so she was speaking from her experience with home care providers and home care aides and the agencies that run those. And actually, it's really interesting because she said that a majority of them are coming from like African American communities, and that they are especially hesitant because of, I am admitting some new people into the call, and I have this fear, Paul, that people had the time wrong for our call because of we have other webinars that start at 12:30, and I have this feeling that we're going to get a few people that come in at 12:30.
Okay.
But so we might rehash a few issues.
Sure.
Members of the African American community who have the fear from the Tuskegee Project and the experiments with vaccinations in the past, and that there's this persistent fear of new vaccinations in the African American community. And so it takes a whole lot for members of that community to take a new vaccine. And that persists now. And that will take a different kind of education and a higher level of education in that community to get them to take a new vaccine. So that was what they were reporting.
Okay, interesting.
Hi, Shelly. I'm seeing who just popped in. Shelly, and we had another person just pop in. Shelly, I'm glad to see you. I have a feeling that some of the old guard, we have some new faces here, and then some of the board members, I feel like we might have had a problem with our time. Our traditional webinar started at 12:30, and this call was scheduled at 12. And so I'm worried that we had a problem with the time. So I'm glad to see you. I know you had a good story about how you got the vaccine. You know, being from an independent practice, you got it from a health system.
Mm-hmm. Yeah, and I apologize. I knew that noon was the time. It's just practice tend to get in your way. I'm sure none of you other administrators feel your practice gets in the way, but it did.
I was just going to say, Shelly's always late. That has nothing to do with it.
Oh, these days I feel like I'm always late. My goodness.
Yeah, I had to put a do not disturb sign on my door because right as I was getting started, somebody was knocking and coming in. I'm like, oh no.
Well, I was home this morning, heading in this afternoon, and it's like, oh my gosh, like it's crazy. You can't even hide at home and get away with it.
Oh.
So.
Do you want to share your story?
Thank you for joining us.
Yeah.
Sure.
Yes, go ahead and share your story.
So my story was, we were fortunate enough. For those of you that don't know, I run a 13 location ophthalmology clinic and a full service multi-specialty surgery center. And we did the big application, which is like, you know, signing your life away, 28 pages of, as my director of nursing calls it, a facility application to become part of Department of Health. It was painful. So we went ahead and did all that. And then luckily we were reached out by our local hospital, Evangelical Community Hospital. Since my surgeons are members of the board and on medical staff, they generously offered injections to my entire staff, which is approximately 150 people. Now it was a, you know, if you're interested basis, you know, no twisting your wrists and saying you have to. And I had approximately 60 staff members take advantage of that at this stage of the game. We just got through our second round, which started last week. So they generously offered that, and this was free of charge. So we were very lucky to have that opportunity. We are still getting our injections or our vaccines. We're still not quite through the process yet. Department of Health keeps telling us one more week, and it's been about 4 weeks now. So if any of you have applied for that, it's a lengthy process.
Wow, I don't know if there's anyone else that's on the call that has applied for that. That's very interesting, and I think you might be the only one that I'm aware of that's actually applied to become under the Department of Health. Wow.
Yeah, we applied to get them for our staff, and
right.
You know, then of course the hospital reached out to us. So luckily, Department of Health was willing to say, okay, we don't guarantee you 50, which would be 100 injections, 50 vaccines. They told us that we can use it as an as-needed basis. Now, since then, I have had staff members that either have gotten COVID, been exposed, decided not to get the vaccine, you know, on this second round. So luckily, they're willing to say, hey, I need 20 vaccines, and they'll just give us 40. So once we get to that phase, but they do check in with us every week. They're letting us know where we're at in the process. So it's been kind of nice to know, but the application, I will warn you, is brutal.
Okay. Well, we had an opportunity before you joined to just share some information, and Nancy is on the call from Philadelphia, and she had shared that they are actually administering the vaccine to some of their patients now, and that they're following the requirements of the city of Philadelphia. So that was an interesting discussion. It was for me to learn that, you know, in the city of Philadelphia, they have their own requirements that maybe are different or supersede what the state is. And then one of those requirements Nancy shared is that you have to be 75, not 65 at this stage in order to receive the vaccine.
Interesting.
Yeah.
Yeah, I feel like in our central Pennsylvania area, we have a lot of opportunity. I know my parents are scheduled, my husband's parents are scheduled for their vaccines. I feel like we have a lot of opportunity to get vaccines now with mostly our local health system. So I'm thankful that I was able to, get it, being in healthcare, because I didn't expect to have it this quickly. And I didn't expect my parents nor my in-laws to have the ability to get it so quickly either.
Right. And here in Eastern Pennsylvania, outside of Philadelphia, we were talking about the Chester County Department of Health being a good source for practices that are in the Chester County / Delaware County area. And they have been able to roll out a lot of vaccines for that 1A group of healthcare providers. But to my knowledge, they have not started administering to the next group, and especially not to senior citizens. Now that may be coming, but I don't think that's happened yet. But just over the bridge in New Jersey, I hear that they are administering the vaccine to senior citizens at this point. So
yeah, it's interesting how it was lotted out. It's, I feel like Evangelical they had a lot. I went on the first round and I was amazed. I waited in line, and you're at a local hospital, you wouldn't have expected, but I was surprised at it. And plus they vaccinated their workers first. Obviously we weren't top dog to get the vaccination.
Mm-hmm.
So
Shelley, what's your experience now, like locally? We had a glut at the beginning. And so they were just giving it to anyone just because they didn't want to go bad. Now, to Paul's point, in Montgomery County, a week and a half ago, you could go pre-register if you were 65 and older, you could pre-register. But now we were getting dates from Montgomery Department of Health and just slots, and we just kept signing up. And now everything's just a standstill. There's nothing.
Yeah, I feel like the primary cares are still giving it, but I do know, as an example, when my parents are patients of the Geisinger Health System, and when my mother went to register for them on the portal, it very quickly went from like January 21st or whatever the date, I'm just throwing a date out there, to like the middle of February. Like she had no option in between. So I have some fear that maybe they did start to run out. I know Evangelical, I got a post on my email earlier today that they do still have vaccinations. They are getting it done in primary care. But, again, I didn't register for that, so I don't know if it's very fluent yet or not.
So Nancy, our primary care person, would it be prudent, I guess, at this point, that for people people like in our practices that have yet to get vaccinated for whatever reason and change their mind, should we be pointing them now maybe to their primary care physician and they could call, like you're saying, primary care is giving priority to healthcare workers. So
Yes.
If our radiation technologists could pick up their primary care and say, hi, I work in healthcare and I need a vaccine, they may jump the line there as opposed to waiting for all these other things now.
Yes.
Oh, great. Excellent.
That would be my suggestion. And the other thing about scheduling is that we are starting to encounter, of course, is you have a schedule for a set number of people, and 4 weeks later, most of those slots are going to be filled with the people who need the second shot. So
Right.
the availability then drops off for the first shot people, unless that was, planned into your scheduling to begin with. So I would think that might be part of the reason for that weird gap, because you have to get past those folks who are just coming back for their second shot. We talked about that this morning, that fortunately we didn't have as many in the very beginning. So if it was 20 spaces, it's 20 spaces in our upcoming schedule, but we still can do 10 new. So we don't block out entirely, but
The second shots, I got
the second shot blocks the schedule for new people until until they're done.
My lesson learned was, had I known then what I know now, like we had whole departments go on the same day. And now that department's going to be empty when they go for their second shot. Like I have a whole crew on February 10th that, I'm thinking, well, I'm going to be the only one in the office that day.
That's funny you bring that up. We did the exact same thing. I had a whole lump of nurses in my surgery center go, and we were all sick the next day. I mean, luckily I worked from home, but I didn't show my video. I think, Erin, I did show you that day. She made me open my lid. I'm like, it isn't very pretty. I'm going to warn you.
Yeah.
Yeah. We've had that thought too, like, oh, everybody was so excited. You did the whole center on one day. It's like, oh, that's bad. Just bad.
Yeah.
So Shelley, you had the same reaction, and obviously you're fine.
Yeah. It was like a 24-hour fever, chills, body aches. I mean, it just kind of stank for 24 hours. But other than that, now I have some staff. So now I got the Pfizer. There are some staff members of mine that got the Moderna. Now, interestingly enough, they got sick on the first injection. So I'm a little nervous. They go next week, and I'm a little nervous what's going to next week bring, because there was some that I actually had out of the office on the first round. Now, I was fine the first
That's interesting.
round. Yeah.
Oh.
We had Moderna here, and nobody got sick on the first round. So maybe.
Really?
Yeah. But we haven't been offered Pfizer locally. Okay. Paul, have you?
No, in our area, I think it's only the Moderna that I'm aware of too. That's the one that I think the Chester County is using.
Yeah. Nancy, what is Philadelphia dispensing? I'm guessing they will be doing both, right? They probably need.
So they have both, about equal numbers from what I understand. And the Pfizer is going to the big places that can handle that refrigeration, and Moderna out into
exactly
spots that couldn't. So like we got the Moderna.
Yeah.
And I suspect getting it through a health system, that's why I got Pfizer. But interestingly enough, my staff, they must have run out of the Pfizer, because now my staff's getting Moderna through the same health system.
Oh, interesting. Wow.
I think there might be one more poll question that's related to this question about whether or not you're making it a requirement for your staff. So maybe everybody can answer this one. And this, Shelley, obviously was one of the other issues we've been talking about, getting a sense for whether practices are making it a requirement. And what we touched on is that for people that are hesitant to get it, a lot of it is an issue of education or lack of education. And Mary Ann had shared that the Pennsylvania Medical Society has some really good resources that they put together to address the education, and it's geared towards healthcare providers.
Paul, I shared that with you. So if you want to share that after the call with the group that is here, you'll be able to do that.
Okay. Well, here we have it. So 60% say no, which is kind of what I expected. And no one is saying that, yes, they're making it mandatory, and some are uncertain about maybe in the future. But I think that seems to be the trend, just in talking to different people, that most employers are not making it a requirement. Although I think legally there are grounds that you could, as long as you allowed exceptions for either medical reasons or religious reasons. So that's interesting. Well, this has been great. This has been very helpful. And I know that you're scheduled to end at 12:45, and I want to certainly respect everybody's time. But before we end, are there any other just comments or questions or thoughts that anybody has that we didn't get a chance to talk about?
I just want to bring one thing up, Mary Ann. I know on our board call, you had asked about incentivizing your staff, and I said that I had reached out to my legal. So what they basically told me is, if you're going to do something, do it not of a large monetary value.
Mm-hmm.
So maybe 1 hour of PTO, or, don't do a full day. They said be cautious of a gift card, but you could do a gift card of a small monetary value.
Yeah, thank you. I did the same, and they basically said you have to be consistent across the board. You got to give it to everyone. And make it a token,
Yeah.
not
And-
an.
And to Paul's point, that's exactly what legal told me. They said, make sure you educate your staff. And they advised us not requiring it, but they said, if you want to go that direction, make sure, like Marianne said, you're equal across the board. And
Right.
yeah, so we're not going to require it at this stage of the game, but we're educating staff who are on the fence.
Interesting. Thank you.
So Paul, we have recorded the call.
Okay.
We will send the recording to everyone that was registered. And in that email, we can send out the link again to the Pennsylvania Medical Society link.
Oh, great. Great.
And Nancy, tell me again the name, was it Athena?
Athena, Athena. It's our electronic health record.
Yeah.
So I'm just wondering if Epic or others might have done similar things.
Erin and Paul, you want to use the links that I forwarded to Paul because they will take you directly to the YouTube videos.
Yep.
So I sent it on to Paul. You'll forward it on to Erin, and then yeah, she included the links. She was very efficient.
Thank you. Thank you very much.
All of that.
Thank you, everyone.
In that email, so that'll all get through in the email. I want to thank you, Paul. You did a great job.
My pleasure. Thank you, everybody, for
Thanks,
participating.
Paul.
Thank
Appreciate
you.
it.
Thank you,
Thanks
Mary.
for letting
Shirley.
me join.
Bye.
Take care.
Bye.
Bye, Shirley.
Bye.
Bye, Nancy.
Bye.
Bye.